Hi, it's Dr. Teresa Cullen bringing you your Pima County Health Update for July 29th, 2020. It's a Wednesday, so we're going to talk about data. I'm going to cruise you through the data overall that we look at and then give you some different groups within that data that we examine as we look at the pandemic and the impact of it. Remember, the health department is committed to viewing data and what's happening in the community through an equity lens. So I'm going to show you how we do that when we look at the data. So first, the chart that you're seeing now is an indication of the cases that are occurring in Pima County. Remember, ignore the last 2 to 3 weeks because those cases are still being accumulated. And as you see, it does look like we may have a little plateau going on here. Of course, it's way higher than we would like. Remember, this is now 10 times the number of cases we had early on, but it does seem to give us some insight that we may be doing okay. The next chart shows you the age groups, and this is a critical chart because it shows you what is happening in the community. The 20 to 44-year-old age group is the group that has the highest number of cases, and you can see it's significantly higher than any other age group. We recognize that many people in this age group have limited symptoms, but once again, these are cases. They are COVID-proven patients. And what's important about that is that these cases can transmit the disease to others. So it's very important that people pay attention to their symptoms and isolate when they are told they are positive. The next chart shows gender, and as you will see, there seems to be a higher number of women that get COVID. However, what we do know is that there's a higher number of men that are hospitalized, and in a future session we'll show you the hospital data. And finally, I want to show you the race and ethnicity data. The critical part about this is the unknowns. So while we look at this and we see that the Hispanic community seems to have a higher number of cases, what we know is at least half of our cases are not identified by race. Without that data, it is very difficult for us to interpret what is the impact of race and ethnicity on cases themselves. In future sessions, we'll talk about that more. This is Dr. Cullen bringing you your Pima County Health Update for July 29th.